Greetings, and thank you for joining us today at the CHCI Health Summit. My name is Ron Estrada. I'm the Senior Vice President, Head of Government Relations and Corporate Social Responsibility at Univision Communications. I'm also the Vice Chair of the Board of Directors for the Congressional Hispanic Caucus Institute, and honored to introduce this exceptional panel discussion. On behalf of CHCI, I'd like to thank Walgreens, Pfizer, Univision, Blue Cross Blue Shield Association, and Merck for their generous support of this session. Our plenary session, Equitable Vaccine Development and Distribution, is a critical and timely discussion as our nation and countries around the world continue to combat COVID-19. Over the past few days, we've heard about amazing breakthroughs and progress on the vaccines that could change the trajectory of this disease. At the same time, there are over 11 million confirmed COVID-19 cases in the United States. Our panel of experts will discuss the pivotal role that vaccines can play in preventing infectious diseases and mortality. You also hear about industry practices and the continued need for equitable and ethical development and distribution of vaccines, clinical trials, and the lessons learned from the COVID-19 pandemic. But before we begin our panel discussion, it is my distinct privilege to introduce our panel hosts, CHC Chair Congressman Joaquin Castro and CHC Whip Congressman Adriano Espaillat, followed by welcome remarks of my colleague, Rosemary Garza, Miguel Rodriguez from the Bill and Melinda Gates Foundation, and our moderator, NBC contributor, Patricia Gutierrez. Congressman Joaquin Castro was elected to serve in the U.S. House of Representatives for the Texas 20th Congressional District, which covers a large portion of San Antonio and Bexar County. Now in his fourth term, he serves on the House Permanent Select Committee on Intelligence, as well as the House Foreign Affairs Committee and the House Education and Labor Committee. Congressman Castro continues to be a tireless advocate for those who call San Antonio home, from supporting military families to investing in education. He remains committed to helping mold an infrastructure of opportunity for San Antonians and Americans around the country. Congressman Adriano Espaillat represents New York's 13th Congressional District. First elected to Congress in 2016, Congressman Espaillat is serving his second term in Congress, where he serves as a member of the influential U.S. House Foreign Affairs Committee, the House Committee on Transportation and Infrastructure, and the House Small Business Committee. A steadfast champion for working and middle-class New Yorkers, Congressman Espaillat is a staunch advocate of a fair living wage, immediate and effective investments in affordable housing, meaningful criminal justice reform, infrastructure improvements, expanded youth programs, and better educational opportunities. Next, you'll hear welcome remarks from my colleague, Rosemary Garza, who is responsible for developing and coordinating federal and state legislative policies that are aligned with Univision and the audience we serve. We're also honored to have remarks by Miguel Rodriguez, Director of Government Relations North America at the Bill and Melinda Gates Foundation. The foundation works with partners worldwide to tackle critical problems. Their Global Health Division aims to reduce inequities in health by developing new tools and strategies to reduce the burden of infectious disease and the leading causes of child mortality in developing countries. To lead this discussion, we are pleased to have as our moderator, Patricia Gutierrez, a multimedia journalist and contributor to NBC Latino, Latino Magazine, and Latino USA, among others. She's also an adjunct professor at American University School of Communication. We hope you enjoy this informative and timely discussion. You can continue the conversation on social media, #CHCI Summit. Now, please welcome our first speaker, Congressman Joaquin Castro.
Hey y'all, it's Congressman Joaquin Castro. It's great to join CHCI's Health Summit, and I hope it's an opportunity for our nation's best and brightest health minds to come together and help us navigate this crisis. The coronavirus pandemic has highlighted long-standing health and social inequities that have put Latinos at higher risk of COVID-19 complications. The numbers are staggering. Latinos are twice as likely to be infected and more than 4 times as likely to be hospitalized from COVID-19. Latinos are more likely to work in lower paid but essential jobs such as farm workers and meat packers. Latinos are also more likely to have pre-existing health conditions like diabetes, lung, and heart disease. But at the same time, we're less likely to have health insurance and the ability to see a primary care physician. And oftentimes, Latinos live in multi-generational households due to the exorbitant cost of housing. As we continue to live through one of the most hectic and uncertain times in history, we must continue to advocate for the health and social well-being of the Latino community. We must find solutions that aim to stop the spread of the virus, including the importance of vaccination. We must prioritize the equitable and ethical development and distribution of the COVID-19 vaccine for Latinos and all communities of color and all Americans that are disproportionately being impacted by the pandemic. Approaches that are culturally and linguistically tailored must be taken. Most importantly, we must work closely with community partners and advocates who have built trust among our communities. As we continue to think about how to best support Latinos during and after this pandemic, we must prioritize both short and long-term solutions. We must continue to work together to help promote equity and help make Latino communities stronger. Thank you for all of your efforts to make our nation safer and healthier. Take care, y'all.
Hello, I'm Congressman Adriano Spalla, representing the 13th Congressional District in New York City, and I'm also a member of CHCI's Advisory Council. Thank you for joining us today at the CHCI 2020 Health Summit and for our beginning plenary on equitable vaccine development and distribution. The summit is providing the opportunity for all of you to participate in some riveting discussions about how vital the health and wellness of our community is. CHCI continues to be an important organization and provides leadership skill for young people, and it leads discussions such as this one to ensure that our community stays healthy. The distribution of the next vaccine will be a great discussion for our community. We must ensure that the vaccine is distributed in a fair and equitable way across income lines, across race and ethnicity, across regions of this great country and neighborhoods that were severely impacted by the COVID-19 pandemic. This vaccine must reach everyone's home. So I hope that you enjoyed the discussion. I hope that you enjoyed this plenary, and I hope that you get a lot out of it and make sure that that vaccine is distributed equitably amongst everybody.
Buenos dias. Hello, my name is Rosemary Garza, and I am the Director of Government and Corporate Affairs for Univision. I am honored to serve as a panelist along with the Honorable Joaquin Castro and other healthcare leaders in CHCI's 2020 Virtual Health Summit to discuss equitable vaccine development and distribution within the Latino community. As we grapple with a pandemic that has disproportionately impacted Latinos, it is important to know your audience before you consider effective distribution of the COVID vaccine. As the leading Spanish language media company in the United States, Univision is in a unique position to work with congressional leaders and healthcare providers to help educate and promote the COVID vaccine. With our national broadcast network, digital platform, and 65 owned and operated local TV stations and 58 owned and operated radio stations across the United States, Univision is the most recognized and trusted brand among U.S. Hispanics. Since the onset of this pandemic, Univision has been on the front lines, reporting, educating, and informing our Latino community on how to stay safe during this pandemic. We have run countless PSAs, produced and participated in numerous town halls, and continue to inform our community on a daily basis through news coverage and community outreach. As we move forward towards equitable vaccine development and distribution, it is important to work with trusted partners like Univision that has a proven record and can effectively reach the Hispanic community. I look forward to today's discussion as we work together to help address the biggest healthcare crises facing our Latino community today.
My name is Miguel Rodriguez, and I'm the Director for Government Relations in North America at the Bill and Melinda Gates Foundation. It's an honor to be joining you virtually for this important conversation. The Gates Foundation is a proud supporter of the Congressional Hispanic Caucus Institute. COVID-19 is a true test of our mission and values as a foundation, as a nation, and as a global community. The health and economic damage from COVID-19 is reinforcing inequities in all countries, and here at home in the United States, especially for our Black and Hispanic communities. At the Foundation, we draw on 20 years of experience in improving health for the most vulnerable around the world and seek to ensure that everyone will have access to vaccines and other tools regardless of their ability to pay. As this pandemic rages, we must continue to learn and adapt accordingly. Throughout all of this, please rest assured the Bill and Melinda Gates Foundation remains committed to our core belief that every person deserves the chance to live a healthy, productive life. Philanthropy can play a unique role in catalyzing new ideas and can take risks others can't or won't. We are putting our expertise, resources, partnerships, and voice behind big bets, not just incremental changes. For example, we use creative financing tools such as volume guarantees and forgivable loans to help life sciences companies offer affordable products to low and middle income countries. We also support organizations like CHCI to lead conversations with key constituencies that the Foundation cares deeply about. Make no mistake, science and data must guide our pandemic response so people can swiftly and safely return to work and to school. Our leaders should continue increasing the capacity to test and safely treat people and trace contacts of all suspected COVID-19 cases. This includes ensuring that low and middle income communities have the medical supplies they need to effectively detect disease and treat and isolate patients. To prevent cases from surging, we must employ data-driven approaches that will allow us to return to working and to learning safely. And we must provide social and economic support to those who need it most. No country can tackle this pandemic alone. A health crisis anywhere is a health crisis everywhere. Attempts by one country to protect itself while neglecting the needs of the rest of the world will ultimately fail. If only a few countries can protect their people, the pandemic will rage elsewhere. It is imperative that we deliver the tools to combat COVID-19 equitably to those who need them most. This includes paying particular attention to the unique needs of the Hispanic community, which has been hit especially hard by the pandemic. We must strengthen our health systems to ensure all countries are ready to deliver these new tools alongside essential health services like routine immunizations and maternal health care. The actions we take now will also build stronger, more resilient health and economic systems that can put us on a path toward a more prosperous world for everyone. Thank you, CHCI, for highlighting this important subject. The Bill and Melinda Gates Foundation looks forward to our ongoing partnership. Thank you and stay safe.
Hi, good afternoon. My name is Patricia Guadalupe, and I'm pleased to be here today to lead a discussion on equitable vaccine development and distribution with industry experts, a topic we're all anxious and excited to hear about. And first of all, I want to thank Miguel Rodriguez, Rosemary Garza, and Congressman Adriano Spalla and Joaquin Castro for their insightful remarks and setting the tone today for our conversation. And I want to thank CHCI for creating an online space to share information and engage our communities on health issues. Now, COVID-19 is a stark reminder of how effective vaccines can help reduce morbidity and mortality if developed in a way that meets the needs of communities of color. And as we grapple with a pandemic that disproportionately impacts Latinos, we're seeing a growing anti-vaccine movement fueling the mistrust of a COVID vaccine in communities of color that could lead to disparities in the vaccination rates. And what we're going to be doing in this session today is start with a discussion about the pivotal roles that vaccines can play in preventing infectious diseases and mortality. And we'll be following with a discussion about equitable and ethical development and distribution of vaccines and in clinical trials and the lessons learned from this pandemic. We want to hear from you, our audience, so please put your comments and questions in the chat, and you can also continue the conversation on social media with the hashtag CHCI Summit. That's CHCI Summit. I want to first start off with introducing our wonderful panel of experts, and I thank all of you for being here today. First of all, I want to introduce Nette Cosero, the Global President of Pfizer Vaccines. Thank you very much for being here.
Hello, good afternoon, and it's a pleasure for me to be here. Looking forward to a very interesting conversation. Thank you.
Thank you. And then Rena Shaw, Vice President of Pharmacy Operations and Services for Walgreens. Thank you very much for being here.
Thank you so much for having me. Looking forward to the conversation.
Dr. Oralia Dominic, Medical Policy Research Analyst and Chief Medical Officer of the organization at Highmark Inc. Thank you so much for being here.
Thank you, and good afternoon. CHCI President Marco Davis, congressional leaders, MC Ronald Estrada, distinguished guests, and panelists. Thank you for this opportunity to be part of this Congressional Hispanic Caucus Institute Health Summit. And again, my name is Dr. Oralia Garcia Dominic. I am honored to speak with you today about COVID-19 development and distribution.
Thank you so much, Doctor. And Dr. Peter Hotez, he's the Dean for the National School of Tropical Medicine at Baylor College of Medicine. Thank you so much, Doctor, for being here today.
Thank you. It's a real honor and happy to talk about some of the unique issues around vaccinations in the Hispanic community. There's some important things to discuss.
Thank you so much, panel, for joining us. I'm going to go ahead and jump right in with my first question. I'm going to do this for Nette Cosero. There's been a lot of discussion about the safety of these vaccines given the accelerated development timelines. The fact that we already have a coronavirus vaccine in development is unprecedented with the speed of it. Can you talk a little bit about how Pfizer and others in the industry have been able to move with this unprecedented urgency during this pandemic, and why the public should have confidence that these vaccines are safe?
Thank you, and yes, hello, good afternoon, and my name is Nette Cosero, and I am the Global President for Pfizer Vaccines, and I am very glad to be here with you today at such a pivotal time in the global effort to identify a breakthrough to help end to this pandemic. By now, you have heard the exciting news we shared this morning, where we have concluded and conducted the final efficacy analysis from our phase 3 COVID-19 vaccine trial with our German partner BioNTech. The trial, which began in July and has enrolled nearly 44,000 participants across approximately 150 trial sites globally, has now met all primary efficacy endpoints, and in addition, the safety milestone required by the FDA for emergency use authorization also has been achieved. We plan to submit a request within days to the FDA for an emergency use approval based on the totality of safety and efficacy data collected to date, as well as manufacturing data relating to the quality and consistency of the vaccine. Like other pivotal moments along this historic 8-month journey, today milestone fills me with great pride and gratitude for our researchers, our partners, and our trial participants and their families who have made such a profound contribution to global public health. I feel very hopeful, and it has been wonderful to see that hope spread around the world in recent weeks. On a personal note, this is certainly the most defining moment I've had experienced in my 18 years at Pfizer. It is a great responsibility, but couldn't be more proud of the way we and others in the industry are bringing our resources and capability to bear, giving our all to address this crisis. And now, to address your question about safety, we have definitely not taken any shortcuts when it comes to safety. We know that any vaccine is only good for public health if healthcare providers and the public trust that it is safe. To that end, we've worked hard to be as transparent as possible through the process of creating the vaccine, and we will continue to do so as we move forward. To echo the words of our CEO, Albert Bourla, we're moving at the speed of science. And I want to be clear that when it comes to safety and quality, we have not made any compromise whatsoever. We have been taking all of the regulatory and operational steps that we would normally, even with the rest of our portfolio, maintaining the highest standards in our development process and absolutely not cutting any corners. We have accelerated the process by doing steps in parallel instead of sequentially. And here are some examples of those steps that we have done in parallel. We began the clinical site selection process earlier than we typically would and staffed up our team in advance to give our operations the support and flexibility needed. We invested upfront in certain areas, such as manufacturing of the investigational product, so that we are ready to execute quickly as decisions are made. Also, in the usual drug development journey, the process of preparing regulatory data packages to submit to the FDA and waiting for its response often take months. However, in the COVID world, regulators are responding to data very quickly, often in real time, to help keep trials running as quickly as possible. So yes, we are thinking outside of the box about how to move with urgency, given the fact that there are billions of people around the world counting on us. But the safety and well-being of vaccinated individuals remains our top priority.
Thank you so much. I wanted to ask Rena Shaw, how do we engage the community? How do we displace the sources that can't be trusted and replace them with the trustworthy sources, given, of course, that this vaccine development has gone so fast, and what Nannette was talking about, that obviously safety precautions have been taken into consideration and are first foremost of anything else. How do you engage the community? What can we do to help the communities look at this and say this is safe?
Yeah, I think that's such a great question. And just a little bit of background, I'm a pharmacist by training, and I'm extremely passionate about the role that pharmacists can play, not only in healthcare, but even more specifically, what's happened with the pandemic. Me and my team are responsible for running pharmacy operations and services across the over 9,000 locations, serving over 8 million people a day. And that ranges across the board. And that includes millions of Hispanic families, many of whom are in medically underserved communities. And so we've experienced firsthand exactly how the COVID pandemic has hit Hispanic communities as well as many other communities across the nation. And it's important because we've been not only through the vaccination piece and helping to educate around that, we've been extremely well positioned to help through all of the activities that have happened through COVID. When we look at our entire footprint, we have about 1,500 locations that are in populations where 25% of that population is Hispanic. In addition to that, we have locations that are in 40% of our medically underserved areas, representing 2/3 of the underserved population. So, our pharmacists are in the communities that are really being hit hard with the COVID pandemic. And in many of the situations, our pharmacists and our pharmacies are the only healthcare provider that's in those communities. So when it comes to COVID-19, we're extremely well positioned to help support. At the very beginning of the pandemic, we were there to help support medication delivery, making sure that we were able to leverage our drive-throughs, offering free delivery to our patients where it was needed, having essential items. Most recently, we stood up COVID-19 testing, and we're able to administer 2 million tests just in a short period of time over 780 locations, just so that we can make sure people understood where they stood around if they were COVID positive or negative. And most recently is the flu season. So, we talk about COVID-19 vaccine, but we've administered millions of doses of flu vaccine. And that was the first step of the education process. We began to engage with many of these communities early on to help them understand the importance of vaccinations and how it was important for them to stay protected around that. Because to your point, there was a lot of hesitancy around vaccines. How is this something that's efficacious? Am I going to be safe if I actually receive it? And so our pharmacists have been armed to administer vaccinations for the past 10 to 12 years. We've developed trust with the community to ensure that our patients understood that they could come to Walgreens, receive their vaccination, and do that in a safe way. And so it started off with the flu vaccine, and we have history and experience with that. We've administered over 60 million doses of vaccinations over the last 10 years. And as we look into COVID-19, similar to what Nanette's saying, we've been planning for this for the past 3 to 4 months in partnership with Operation Warp Speed, HHS, CDC, as well as many of the manufacturers, speaking with Pfizer on a continual basis just to make sure we're prepared. And we're arming our pharmacists to educate our patients about the safety and efficacy around the vaccine so that we're appropriately sharing that education with them, because that is, in addition to hand washing, wearing a mask, keeping yourself socially distanced, the next step is vaccination and making sure that everyone can get back to that new normal. And our pharmacists can play a critical role in that, especially since our pharmacists are considered one of the most trusted providers out in the communities out there.
Thank you so much. I wanted to follow up with that with Dr. Hotez. With this whole issue of mistrust with the anti-vaccine movement, and what can Latino families do to, to diffuse this misguided fear of vaccinations within the community? The type of thing that people are looking at, saying, well, this has been, as we've talked about, developed so fast. How do I know? How can I be sure that this is okay?
Yeah, I think this is an extremely important question. It has gone quickly, but one of the problems with Operation Warp Speed has, even though it's an amazing program and it's producing and delivering extraordinary new vaccines and new technologies, that there hasn't been a level of communications that's been commensurate with the science. So the science is being conducted with incredible rigor. The integrity of the clinical trials is extraordinary, and yet there's no communication plan coming out of Operation Warp Speed. There are no communications. It's all being left to the pharma CEOs, and they are doing. There's a lot of variability in the quality of those communications coming out of the pharma CEOs. I think some are doing better than others, depending on whether or not they're traditional vaccine companies. And the reason I say that is because vaccine communication is very fragile. The vaccine ecosystem is very fragile, and it doesn't take much for a good vaccine to be voted off the island and not used, even if it's a good vaccine, because of this. And so we saw this with the Lyme disease vaccine from GSK, one of the rotavirus vaccines from Wyeth, and so we have to be really careful that we already have 2 surveys showing that a significant percentage of Americans will not take COVID vaccines, even if they're made available. I hope that percentage, and those are from Associated Press and Reuters, I'm hoping those numbers shrink as the American people start seeing people get vaccinated without any untoward effects. And so I think that number will diminish, but it's still going to be there. And how you respond has some important consequences. I think right now it's all hands on deck in terms of trying to shape that message, deliver that message, and fine tune the message. I can't tell you how many Zoom calls I've been on over the past few months about how to shape that message, and that's good. But then I kind of pop everybody's bubble by saying, you know what, the best message in the world is going to get you about 30 to 40% of the way there. And the reason is because it doesn't take into account the fact that we've got an incredible anti-vaccine movement that dominates in a negative way the internet. more than 480 fake anti-vaccine websites, all revved up on social media. I mean, e-commerce sites. If you go to Amazon.com, put books up at the top, press return, you get that scroll down menu to the left that everyone's done 1,000 times, and you'll see health, fitness, and training. You click on that. Under vaccinations, you'll get all crap. You'll get all fake anti-vaccine books that are written by very aggressive anti-vaccine lobbies. So the point is, the anti-vaccine messages dominate the internet right now, and it's getting worse. A lot of it started, unfortunately, where I am here in Texas, with this kind of fake concept of freedom, medical freedom, where it really took off in 2015, 2016. And then what happened it nationalized. This is when dedicated anti-vaccine groups were created at the national level, like Children's Health Defense, which is causing a lot of damage. And then this year, the anti-vaccine movement, you would have thought would have gone into retreat a bit after everybody wanted COVID-19 vaccines, but somehow they've been managed to re-energize under the fake health freedom banner. What they've done now is they've glommed on protests against masks and social distancing. So it's become a full-on anti-science movement. And to make things even worse, you've got now the fact that over the summer, it was reported in these same groups in the US have now traveled to Berlin, Germany, to Paris, to London, and there's been massive protests and odd stuff happening, links to QAnon and neo-Nazi groups. And so this is taking a very dark turn, and they have funding. And the problem is this: nobody wants to take this on. You know, the U.S. government won't take it on. There are no NGOs or philanthropies that really want to address what needs to be done, which is to figure out how to begin dismantling this anti-vaccine, anti-science empire. And now it's even getting worse because the Russian government and Putin and through Russia Today is also now piling on anti-vaccine messages to destabilize things. So it's very tough to figure out how to do this. The UN agencies, it's too inconvenient for the UN agencies to want to take this on. The US government, no philanthropy wants to sort of get their hands dirty with this. So I'm doing what I can, and of course I get beat up a lot. Having a daughter with autism and writing this book, Vaccines Did Not Cause Racial Autism, Robert F. Kennedy, the lead anti-vaccine activist, has publicly named me the OG villain. And I had to look up what that means. It means the original gangster villain. So you're hearing from the original gangster villain today. And I don't know how until we have the appetite to start dismantling it's not going to happen. Congress tried to hold hearings in 2019 after measles came back, the House Oversight Subcommittee and Senate Help Committee, but there really wasn't the follow-up. So it didn't really, so not much happened. So this is what we're dealing with. So I think in the meantime, we have to push hard on the message, but it's a really formidable undertaking. And I think it's great that we're fine-tuning the message and doing these kinds of things. But as I say, it'll take us about a third of the way there until we take this on in a big way. If I could just make one last point, because I will have to leave early, is one of the things I'm worried about, looking into the tiered system of who gets vaccines first. There are some discussions about an age 65 cutoff for those groups. And the reason I'm concerned about that is work coming out of the Centers for Disease Control this summer now finds that 35% of the deaths among the Hispanic community from COVID-19 is occurring in people under the age of 65. So what's happening, it's 45 to 65-year-old age group among Hispanic communities really getting hammered. And so, I testified to the Congressional Hispanic Caucus to make the point that we're losing a whole generation of mothers and fathers and brothers and sisters in the Hispanic community. We're going to have to find a way early on to get that age group vaccinated among the Hispanic community. And do, and I think people aren't really considering it. They're not really considering the special requirements for the Hispanic community. So that age 65 cutoff, and this, especially now, it's such a terrible period that we're going to. I mean, if you look at what's going on in El Paso, Texas right now, it's a slaughter going on among mothers and fathers, in the 40s and 50s and up to 65. We've got to prioritize that group for getting vaccinated. And right now, it's all up 65 and older, and we're going to miss that because nobody thinks about the Hispanic community. They think about everything else, and so we're going to have some advocacy around that point. I wanted to make sure I got that in.
Yeah, thank you, Dr. Hotez, and we'll certainly go back to you before you have to leave. But you bring up an interesting point that I wanted to follow up with Dr. Dominic about. We're talking about the challenge of communication and making sure that the pushing back on the anti-vax movement. But what about the challenge of distributing vaccines, the actual getting it out there, and how much is this going to cost? And who is it going to be available to, and the impact on the Latino community? Dr. Dominic, if you talk about that, especially with, how can somebody get it if they're afraid to go out in public? Even if they're not anti-vaccine, this is another one of the challenges out there.
Right. Patricia, thank you. That's an excellent question. I'd like to first share with you that I have spent a significant amount of my training understanding health disparities and how to close healthcare gaps, especially for racial and ethnic minorities that, for whatever reason, always tend to have an extra burden to face under normal circumstances and even a more difficult time during a pandemic. As a behavioral scientist and a cancer researcher, health disparities research, I do value science. And I believe that science has made many advances, our modern medicine as well as technology. And today what we're witnessing for first ever is one of these vaccines that can be with a high effective rate that could be offered to try to mitigate this COVID-19. I am also, secondly, I'd like to share with you that we have lessons that we've learned over time. And there are agencies, specialty societies, and scientists that have also designated the resources as well as the commitment to help close these healthcare disparities gaps, especially for Latinos or racial and ethnic minorities or persons of diverse background or people of color. I think over time we've learned that there are needs for everyone, but there's also added needs and unique needs, in this case for Latinos. Thirdly, I want to highlight that there is something we can look back, which is called a strong track record. I know that Highmark does recognize, and the company that I work for, we do recognize that health disparities exist. We face the same challenges in closing these disparities as each and every one of you do. But I am happy to report that we've learned because we have been actively engaged in the community. And it's been not just right now during the pandemic, but our efforts have really extended since decades ago. Although I do believe that there is some track record of our advocacy back in the 1800s, 170 years ago. But fast forward in time, what have we learned? We've learned that, number one, this is a pandemic, and we faced one 100 years ago, right? The Spanish flu. We've also learned that individuals need a trusted source. Individuals need solutions. And more importantly, they need to be heard, and they need to also have individuals commit to meeting these health disparities and to follow through. At Highmark, we have 5.6 million members in 2020. We also have a service footprint in Delaware, West Virginia, and Pennsylvania. We have customers nationwide in all 50 counties or 50 states, including the District of Columbia. And we are not facing just how to address health disparities today on November the 18th of 2020. In fact, we have been so proactively closing gaps in healthcare that we even received the NCQA multicultural distinction for our works in closing health disparities. what I'd like to say to you is that we do this with a evidence-based approach. And this evidence-based approach is one that's very unique, but it's also evidence-based. And I believe we're among the first, at least 2 decades ago, to start having individuals that we want to serve and help to help inform the decision making. And that is one of the strategies that we use for our members and also for the communities that they live in. We try to close healthcare gaps, but the solutions have to come not just from one person, but they have to be informed by all stakeholders. And we also need a hands-on deck approach. With that being said, we also recognize that we've learned that in America, we have a changing demographic profile. We also see that demographic profile change in the service areas that we serve. I personally live in Pennsylvania. In Pennsylvania, we have about 12.8 million individuals. 7% are Latinos. But we've been out in the field to realize that there's high growth. And in our 67 counties, some counties are even experiencing 2 to 7 times the high growth for Latinos. So we do have Latinos and we have specific needs that need to be addressed. I also want to highlight that there are strategies that we do have. One is community-based participatory principles and frameworks and research that allows us to reach into the community and work closely with community leaders. I also want to highlight that in our service footprint of our regionally focused Delaware and West Virginia and Pennsylvania, 2 of those 3 are what we call federally defined as rural Appalachia. And in these 2 areas, in these 2 states that are what we call rural areas, we do even see higher burden of mortality, morbidity, for most chronic diseases, as well as injuries, whether be intentional or non-intentional. And today in 2020, starting in March in Pennsylvania, we were declared the state for this COVID-19. What we do have, though, is a model that does work because it is an inclusive model, and it is one that has the Latino voice at the table. In fact, we work so closely with our leadership, and not just leadership within Highmark, but we have a leadership that extends also with externally or outside the walls of our enterprise. And that particular leadership also includes our close communication with our federal and state public health experts, with community leaders, as I mentioned to you. But we also have a designated unit called the Salud Unit. In our company, we have what we call business research groups, and we have over 2,000 members over the 8 different groups that we have, and they help inform decision making. And it is a Salud group that in part was the voice for the Latinos, who also said community-based interventions are important, faith-based interventions are important. And we did exactly as they had recommended, and we went out into the community and we've been closing gaps simply because we've learned of them. We've been working with the Latino community. We are a trusted source. And more importantly, we allow that everything that touches the community, that information is accurate, that information is timely, efficient, and that it is more importantly culturally appropriate and culturally sensitive. The last thing I want to share with you is that we do have what we call the vaccine at present. And we are able to see modern medicine and advances in medicines allow us to now further mitigate COVID-19. We know that during COVID-19, if we look back since March, we've learned a lot. And we've also learned what barriers to PPE were. We've learned the Latinos said that they needed access to education. They needed access to PPE. They also needed access to testing. And we coordinated with our strategic partners. We have an integrated healthcare delivery system, and we have a good representation and partnerships with the community, including the Latino community. And through those efforts, we were able to provide over 1,000 testing for medically underserved populations, including racial and ethnic communities and Latinos in over 17 cities here in Pennsylvania. We were able to provide education about how to prevent you from getting COVID and spreading COVID. And we did that for over 5,000 individuals and their families. We also responded to PPE. They were asking, and not just PPE for the healthcare force, they wanted for the first responders that were ensuring that our delivery supplies were not being disrupted as COVID was doing in Pennsylvania. And so we provided PPE equipment through masks and sanitizers. And those went directly to the local businesses in the Latino communities. It went directly to, in fact, those PPE materials were even made by local minority businesses so that we could also help mitigate the disruption as COVID was impacting local businesses. And so this model is a three-pronged approach that we've used. It's evidence-based, it involves and incorporates Latinos, and they have responded simply because we were committed to recognizing that health disparities exist, that there are unique needs. And when we learn of those needs, we just don't talk about them, but we do our best to address those needs. And we continue to be fully committed. We'll talk a little bit later about additional strategies, but I do know that there is a comprehensive strategy that Highmark has used, is using, and will continue to use that is translatable for COVID-19 dissemination and distribution of this vaccine. And I'm confident that the Latino community, with the right delivery and the right trust and the right track record that individuals and organizations can have, the Latino community will respond. We know that Latinos are resilient. We know that they're very good and reminding us of what we've done right and reminding us of what still needs to be improved. But they've all said that they want to be able to protect themselves from COVID-19, from getting it, and from spreading it. And that's also true for their loved ones, and it's also true for their neighbors and the communities that they live. So again, we utilize a community-based model, and we are committed to continue to work with you and with others and with the Latino community to help in the efforts that we can. And again, to translate these vehicles and these models to distribute the COVID-19 vaccine.
Thank you so much, Dr. Dominic. I want to remind everybody that if you have questions, to go ahead and put them in the chat, and then we'll have a chance to go through them in the latter part of our session here, and also follow with the hashtag CHCI Summit. I know that Dr. Hotez, you need to be leaving very soon, so I wanted to ask you if you had any final thoughts on the distribution of the vaccine, on the participation of Latinos. How would the average person who's not a first responder, who's not a healthcare provider, the question being, when would the so-called average person out there be able to get the vaccine? And do you see it? I know that Dr. Fauci has talked about it being available in the spring. What do you see from the medical community that we can look at for the Latino community as far as the vaccine availability?
Well, I think first of all, the good news is that vaccines are coming. I think Pfizer is the first to apply for emergency use authorization, and congratulations to my Pfizer colleague on all the great work that Pfizer has done. By the way, I got my start in science from Pfizer. I was a Pfizer fellow after my PhD, so special place in my heart for what Pfizer's done for my career. Afterwards, I think Moderna will come along pretty soon after that, and then the two adenovirus-based vaccines will be coming. I think the J&J and the AstraZeneca Oxford. So the hope is that we'll have a mini vaccine ecosystem in place by the middle of first quarter next year. And And each vaccine has different strengths and weaknesses. We don't really know the full characteristics of all these vaccines in terms of durability of protection. How long will these vaccines last? Whether or not there could potentially be additional safety things that happen down the line. And so there's going to have to be an unprecedented amount of communication. We might need to have boosters for these vaccines later on. And the good news is there's lots of different vaccines being put out there. We have a vaccine that we're now accelerating that we developed at Baylor and Texas Children that's being scaled now in India for 1 billion doses. So that's another potentially will come in later on. And then the question I get asked all the time is, hey, Dr. Hotez, which vaccine are you waiting for? And the answer is a very simple one. I'm not waiting. I will take any vaccine that's authorized by the Food and Drug Administration because I have confidence in the Food and Drug Administration. I have confidence in the CDC, number one. Number two, we know other than social distancing, the thing that we need to have in our system more than anything else are virus neutralizing antibodies, which is how all of these vaccines work, whether it's Moderna, Pfizer, AstraZeneca, or ours, or J&J. They all work by inducing virus neutralizing antibodies, and they all work to have different ways to achieve that. So I'm really worried for myself and for my family going through this horrible, horrible winter as things get really dire in Texas and across the midsection of the country, not having virus neutralizing antibodies on board. And I will take any of the ones that's offered to me. We may not have a lot of choice first. And it may turn out that not every vaccine is equally durable in terms of protection or performs equally well. But you know what? So what? At least we'll have virus neutralizing antibody in our system to get us through this winter and spring when things are going to be so awful. And then later on, if it's shown that there's a better vaccine or one of them is superior than the others, we could probably get boosted. So the point is, don't overthink this. Don't try to cherry pick which vaccine you think you're waiting for. You're not going to be in a position to do that. Get what you can, get them vaccinated, protect yourself and your family. That's point one. Point two is I'm especially worried for the Hispanic community because health communications is often slow to permeate that community. Some are, here in Houston, some of our communities are somewhat insular for good reason, right? They're worried about being evicted or having terrible things happen to them. And so the health communication, mainstream health communication messages often don't enter that community. And so that's why I try to do whenever I can to speak in Hispanic outlets with Univision, especially. Univision's been really good. Also Telemundo's been good, but I work with Daisy Rios a lot at Univision to try to get that message out. And only she knows how awful my Spanish is. So I try to do my best, but most of the time in English. But I think this is really important, getting that health message out and recognizing that some of the communities, especially in Texas and elsewhere, in Arizona, have to worry about just survival and have been forced to become somewhat insular. And so figuring out ways and really understanding that, bringing in people who really know the Hispanic communities at the local level to get those messages through is going to be really important.
Thank you so
Patricia,
much,
can I build?
Yeah, go ahead.
Patricia, I was just going to build on that. I think Dr. Hotez just mentioned a key component is communication. And especially with the COVID-19 vaccine, communication is going to be critical. One, that the one dose is not going to be the only thing that needs to happen. They need to receive their second dose. So that's going to be critical to make sure that all of our patients that receive maybe the Pfizer product, the Moderna product, if it's AstraZeneca, they will have a second dose. And for us, what we've been planning to do is we've started a very strong activation plan, especially since our infrastructure with prescriptions is to ensure people are adherent to therapy. The same way would be founded with the vaccine. So leveraging digital tools when we can, being able to call patients when we can, and also just leveraging our current assets such as communication on a daily basis. We have customers coming into our stores just for their essential needs. Explaining and educating on the importance of that second dose is going to be critical. And so we've been working diligently, similar to what Dr. Hotez has said, through our channels, not only at the central aspect of it, so what technology can we use, but then leveraging our pharmacists and our technicians at the front line, because they're the ones that also live in the same communities that they're serving. And so our pharmacists being able to educate about that first dose and when to come back on day 21 or day 28 to receive their second dose is going to be critical. That's one barrier. And the other barrier that I think is going to be critical is cost. And so many of the questions that we've received is, how much is this going to cost me? If I'm worried about putting food on my table and I have to pay for a vaccine, how is that going to work? And, we've been working with the government, we've been working with payers, and from our understanding at this point is that there's no out-of-pocket cost for patients receiving this vaccine because it is covered by the federal government. And so, just wanting to make sure that education is going to be critical, but then making sure we're addressing these key points is going to be important so that we can make sure that we're addressing a lot of the concerns that the community has.
Yeah, thank you so much, because I was actually going to go to you and ask you that. So you read my mind, but thank you very much for
Great.
those. I wanted to let Dr. Hotez, since I know you have to leave in a couple of minutes, if you have any final thoughts that you want to leave with us to sort of put the agenda forward as far as what do you think is going to happen next. And I do want to thank you for being part of this panel. And if anybody is a follower of CNN or MSNBC, you see Dr. Hotez quite a bit on there. And as a journalist, I think you do an absolutely fantastic job of explaining it to somebody who doesn't have a medical background. And so I want to thank you for being on the panel. And I know that you have to leave real soon, but I wanted to just see if you had any final thoughts before we let you go.
Yeah, thank you so much. First to follow up, and I appreciate the comment very much. First, I want to follow up on Rena's comment. She's absolutely right. Pharmacists are so important to this, and we don't give them enough credit. We don't highlight their role in the vaccine ecosystem. I don't know about you, but every vaccine I've gotten as an adult has been given by a pharmacist. I mean that, and you're right. In many communities, the pharmacists are more respected and more trusted than any other healthcare provider because people have daily contact with them. So they are key to this whole vaccine ecosystem. And I've actually been talking to schools of pharmacy because the amount of vaccine education they get is variable. Some, have a lot, others, not as much. And so that's absolutely critical. Thank goodness for all our pharmacists. The last comment I'll make is, since vaccines are arriving, I've all year I've been pushing hard in my communications about social distancing and wearing masks, and in the past I never had a right-hand bracket to that. I never was able to say, when we can stop doing this. Now I can, not immediately, but in time things will evolve where we'll have the US population vaccinated and life will be much better. The thing that I'm worried about now during this very chaotic time of transition, we estimate, the Institute for Health Metrics estimates 150,000 Americans will lose their lives between now and February. And nobody has to lose, none of those 150,000 Americans have to lose their life. And of course, there's going to be a disproportionate impact on the Hispanic community. And we're already seeing needless deaths happening in El Paso and New Mexico. So the new word to get out is we need to do, it's all hands on deck and saving lives now. Imagine how horrible you'll feel if you lost a father, mother, brother, or sister now, when all you had to do is get them to the other side and get them vaccinated and they'll live a normal life. And this is a tough message to get across here in Texas and New Mexico. And Arizona and places like that, or in Chicago, we have a big Hispanic community. But somehow we have to do that. Nobody has to die over the next few months, and especially since once they're vaccinated, these vaccines are going to save their lives. And so that's to me, the message I've been pushing hard on when I get the opportunity at CNN, MSNBC, elsewhere.
All right, thank you so much, Dr. Hotez. I understand that you need to get on an important call related
Yeah,
to
thank you.
vaccines. So thank you so
Yes,
much.
thank you. It's been a real honor, and I enjoy meeting everybody. And what you're doing is so important, getting this message out. Thank you for everything you're doing.
Thank you.
Thank you,
Bye-bye.
Doctor.
Thank you.
Before we move to the Q&As from our audience, remember that if you have a question, put it in the chat and follow again on the hashtag CHCI Summit. I wanted to ask you, Nanette, speaking of all hands on deck, the clinical trials, when you're looking at the population, what was the participation, if you have that, of the Latino community in these clinical trials? Because as we know, or anybody who follows healthcare issues, or the communities of color, all of them, the participation in clinical trials has always been lower than their percentage of the population. What about in this particular clinical trial? How was that?
Yes. Well, thank you. Thank you for your question. And yes, this has been top of mind for the design of the clinical trials for the COVID-19 vaccine for Pfizer BioNTech. We selected our trial sites with diversity at the core of the decision-making process, establishing global sites in Argentina, Brazil, and in the U.S. These sites include Arizona, Florida, New York, Texas, all states with large numbers of Latinos. We partner with trusted grassroots organizations like the Hispanic Federation and Dia de la Mujer Latina to raise awareness and understanding about the importance of trial participation. And we work to reduce barriers to enrollment, like having all the materials in Spanish and helping in the education in that space. We've been tracking our progress publicly on our website, Pfizer.com, with updates made on a weekly basis. And if you visit the site, you will see that about 30% of US participants enrolled in our trials have diverse backgrounds, and 13% of US participants enrolled are Hispanic and Latinos. Globally, the number of participants with diverse backgrounds is about 42%. So as an industry, I do hope that we will continue to hold ourselves accountable in this area and take our learnings from COVID-19 and apply them to more trials moving forward. And for me as a Latina, I feel a personal responsibility to make this a reality.
Thank you so much, Nanette. I wanted to move now to we have some really interesting questions from the audience. And so I want to ask this question from Manny Mendoza. After people get the vaccine, should they continue practicing social distancing and wearing masks? Do you think the vaccine is something we will have every few years? Now, this is really interesting because, there's been, the vaccine is going to be the be all end all, but here Manny is asking, okay, well, if we have the vaccine available, are we going to be able to, go back to quote unquote normal lives before, or should we still be cautious? And I'll ask that of any one of you who want to go ahead and tackle that question to see, do you think we should continue to practice social distancing, to have a mask? Go ahead.
Mm-hmm.
Go ahead.
Yes, I can begin with a response to that question along the lines of what Dr. Hortis mentioned. We are going to be having very efficacious vaccines, right? We are, like I mentioned, we're looking to file our Pfizer-BioNTech vaccine in the coming days, and if approved by the FDA, it is a vaccine that data so far has demonstrated 95% efficacy and very high safety, with only fatigue as being one of the side effects, with a level of 2%. Um, and so, yes, while we still don't have the data to know the persistence of the immunogenicity that the vaccines will produce, and until we do get a high enough level of vaccination across the population, it will be important that we do continue the distancing and the wearing of our masks, even once we are vaccinated, to be extra careful and to understand, until we do understand, for how long are we immune, or for how long are we protected, I should say.
Yeah,
Yeah, I was just going
so
to
that
echo what
the message is to be safe, rather to be safe than sorry. Go ahead. I'm sorry. Go ahead.
No, it's okay, Patricia. I was going to just echo what Nanette said, which is, and also in addition to that, it's going to take a while to immunize the entire country and get herd immunity. And so, this is going to be much more of a journey than, it's not going to be solved for in 1 month after the vaccine is available. We're going to ramp up once vaccine is available. So it'll be important that we continue to socially distance and wear our masks and wash our hands, and continue those practices. And then to Nanette's point, as manufacturers continue to give us data to help us understand the length of immunity that individuals have, then we'll have a sense of, what does that next phase look like on revaccination or boosters, as well as, can we get back to our new version of normal?
Yeah, that's true. So so the message is, be just in case. Better to be safe than sorry. I wanted to. We have a question here from Megan, and I wanted to ask Dr. Dominic about this. How will health insurance companies such as Highmark support the equitable distribution of the vaccine? Did you want to go ahead and tackle that one? What are we looking at as far as making sure that vulnerable populations, people who don't have access as much as other folks, how are we going to be able to help ensure that they get the vaccine?
Thank you, Patricia. That's an excellent question. And first, I just want to say that Highmark does acknowledge that we now have the ability to bring this vaccine that is much needed, and in the communities, for Latinos in particular, that would have access to it. I do know that we have two things that we have to always consider. One is, are we committed to closing the gaps and these inequities? The second thing is, how are you committed? Because what happens is, if you have a population that has a need and is asking for the vaccine, we must respond responsibly, and we must all do our parts so that we can deliver. Specifically, what is Highmark doing? Highmark is using what we call a public health approach, and is letting science lead. This public health approach does have three prongs. One is for primary prevention, the second is for secondary prevention, and then the third for tertiary prevention. And basically, in the primary prevention, that is the point where you provide the accurate information, and then you make in this case the vaccine available so that it could be not just offered to the community, but that it could be tailored to the wants and the needs of the Latino community. In working with the Latino community, they always remind us that the customer experience matters. So as they go, for example, to get the vaccine at a pharmacy, or if it's going to, believe right now it's by a provider that's being provided or providing the vaccine, that they would want to have good open communication, and that communication would also give them the ability to address language barriers, cultural competency, and access. And we work very closely with our leadership. We work very closely with our strategic partners and with federal and state public health experts so that we know exactly what is the best strategy to use to help minimize the gaps or the disparities. And we also work, more importantly, with the community leaders that are very good at helping us come up with the strategies as to what the wants and the needs are, when to offer it, where to offer it, and then how to make it available. Most importantly, all of this is just to close these healthcare gaps and to improve the health outcomes of Latinos. So Highmark is, again, able to participate in the reduction of the COVID-19 incidence and what we also call morbidity and mortality. And you do that by having a commitment to the Latino community and to continue to work with them and listen to what is the best way to bring these. Many of these things that create these inequities, many of these are modifiable, meaning we can change. And we are committed to make any changes that are needed so that there is the distribution. And as I mentioned to you, the integrated healthcare delivery system that we have, as well as our policies that are timely and efficient, and also able to be ready so that when we do have the vaccination hitting the market and Latinos start taking the vaccine, that we'll be ready in our end to make it accessible. And I believe right now there is, as was mentioned by Walgreens and also by other specialty societies, that at this point it seems like it's going to be no cost. And Latinos did say that that was one of the biggest barriers. How much is it going to cost? And where do I have to go to get it? Do I have to take off work? Do I have to, is it safe? And I think that today we can answer safely and accurately that based on these data for the vaccines, 95% effectiveness means that it's safe. It means that it's not the 30 to 50% that Dr. Fauci had mentioned earlier. We've learned now that safety is a priority for us, and here's a vaccine that's over 95% safe or effective, I should say. And then the second thing is, how much does it cost? Right now, CMS has indicated that there will be no cost for individuals with that are Medicare. And they've also encouraged all the health plans to do that as well. So I don't think cost is going to be a significant barrier as it was initially thought. And access, if we continue to use our infrastructures and our integrated delivery system, I'm convinced that these can be translatable to the dissemination of the COVID-19. Again, just taking it to the communities and making sure that we are able to continue to see and work together what's best for getting it to the Latinos.
Thank you, Doctor. I wanted to follow up with that and ask one question, an interesting question here, where one of the members of the audience was asking, is the vaccination going to be mandatory? But my question twisted a little bit, should it be mandatory? Like when you take when you register your children for school, they have to be immunized. So I wanted to ask this question to the panelists. Should this be a mandatory vaccine? And should there be penalties if it's not, if you don't do it? So who's ever brave enough to, to answer that? Go ahead.
Well, I can get us started. Let me just first begin by saying that that the CDC envisions a system where the vaccine moves from the manufacturer either directly or through a centralized distribution to a variety of vaccine administration sites in the states. And the CDC is working via its ACIP group to make recommendations on who should be prioritized to receive initial doses of COVID-19 vaccine. And these include healthcare workers, first responders, essential workers, and those individuals who are at higher risk for COVID-19. So the CDC will be, and also addressing a question that was raised earlier, the CDC will be the driving government body that will make the recommendations on how we will or should we be getting protected as the vaccines become available. Now, whether they will be mandatory, we have to see how each state government manages that piece, but I will pass on that piece to maybe Rena or Dr.
Sure.
Dominic to address
Yeah,
that, to provide
um,
your thoughts.
Yeah, I think Nanette said it really well. CDC and ACIP will provide their recommendations on who's recommended to get the vaccine, and also the priority groups based on vaccine allocation and availability. And so that's going to be step number one. Now, should it be mandatory, or should we penalize individuals that don't receive it? That is something that, it's a debate that I know many have had internally. And from the conversations that I've partaken, it isn't something that is being discussed on mandating vaccine, because it is everyone's individual choice. And there may be allergies, or there may be reasons why an individual wouldn't be recommended the vaccination that, we'll learn. It might be the contraindications that are in there. However, there have been discussions about incentivizing vaccinations. And so, the opposite of, how do we encourage individuals to get vaccinated, because we know it's good for the public. And, it's the same debate as, do we mandate masks across the country? It is going to be dependent on every state on what they are recommending, the departments of public health, and what they're recommending as well, and what's happening with COVID transmission. The last week has been pretty dire to see what's happening across the country, and how transmission continues to spread. And so all of these different factors will influence state and federal government on their recommendations, but I don't foresee a national mandate happening. However, again, my point of view as of today, in a couple of weeks, watch something will completely change. But at least from as what we see today, it's something that will be highly recommended.
Well, thank you. We have another question here to follow up on the availability of the vaccine. What about for the undocumented population, people who don't have insurance, where Medicare and Medicaid is picking up the cost, and insurance companies look like they will, but what about the undocumented population that doesn't have access to health insurance, and for folks who simply just don't have health insurance right now? Did you want to take that question, Dr. Dominic?
Certainly. We certainly know that Latinos face barriers to comprehensive health care. We also know that the Affordable Care Act, reducing the number of uninsured Latinos, has fallen a little bit less than optimal. There's approximately 20% that lack coverage. And that's true before a pandemic and during a pandemic. So there are healthcare disparities and access. And the question becomes, who should have access to these healthcare? Right now, we're talking about a very specific group, which are Latinos. And we know that Hispanic Americans, they have the longest life expectancy in the United States, with lower prevalence of many chronic health conditions. In the past, this used to be called the Latino paradox, that though they are always perceived as though they would be the individuals that have the highest of everything, in reality, they tend to have the lowest incidence in many cases. or the prevalence, I should say, as well. And they have high expectancy. What we do see is late stage diagnosis on many of these, where they start to rank a little higher. We do know 35% are less likely to develop heart disease, 49% are less likely to develop cancer when compared to non-Hispanics. What we do know, though, is as Hispanics, there is a younger generation. They tend to be younger group, and so the chronic conditions that takes years to develop are really where we find ourselves in the priority areas, are the conditions that occur when there's a higher age, or that the prevalence increases with age. So, for example, we have like 40% of Medicare fee-for-service Latino population, they have hypertension. 24% of the same Medicare fees for service from the Latino population have diabetes. But overall, we do know that when it comes to the flu shots, Latinos are the least likely demographic group to get a flu shot. So I believe that rather we have the ideal situation where everyone has access. Having access and who pays for it is very important. But more important is, are they willing to take the flu shot? And that is where this distribution of equitable COVID-19 vaccine distribution becomes important. I share with you that there are strategies, as I mentioned to you, to address health disparities and to close these gaps. But when it comes to access, everyone should have access and high quality of access. And it'd be true, rather it be for healthcare, for any healthcare need, or for a COVID-19 vaccine. So I hope I answered your question. And I thank you for that viewer or that listener, the audience, for using the chat box and submitting these questions.
Thank you so much, Doctor. We are unfortunately running out of time, and so I wanted to ask each panelist to share a final thought that they want to leave the audience with. And I want to start with you, Nanette. What are some final thoughts that our audience that you want to leave our audience with? And if you could just keep it to a couple of minutes, since we're running against the clock here.
Sure, I'll be brief. And again, I want to thank you all for the conversation, because this conversation is doing exactly what we need to do, which is raise awareness and education around the importance of protecting ourselves against corona and against COVID-19 virus, and we will have a vaccine coming soon that will help us to protect ourselves against COVID-19, and it will be extremely important. I'm counting on my panel colleagues and also all the listeners to continue educating yourselves in terms of the safety of the vaccines, but also in terms of the importance of really getting protected and vaccinated, because it's going to be one of the most effective solutions to end with this pandemic. And if we don't all get vaccinated, then we will not achieve, like Rena mentioned, we will not achieve the herd effect. We will not achieve the level of protection that we need to indeed end with this terrible pandemic. And so I'm counting on all of you to continue helping us in spreading the word and in ensuring that the education and the awareness is there, so that when the vaccine is available, we all go and get it, because I do see it also as our duty to society, as our duty to our fellow people. Like I said, it's the only way that we're going to really end with this pandemic as soon as possible.
Thank you so much. Rena, do you have a couple of real quick final thoughts?
Yep. I'd echo the thank you. I think this is the exact right conversation, and thank you so much for having me, as well as being a part of this panel to speak about this incredibly important topic. I would echo what Nanette said, is we need to educate effectively over the next couple of months, and also be patient. It's going to be important that vaccine will be available, and we need to ensure that everyone understands the value of the vaccination, and when the time comes and they're eligible to receive the vaccination, partner and learn where you can go to get that vaccine. And we have 225,000 employees at Walgreens that are ready to go to help support the administration of this vaccine. We just need to make sure that all of our communities are well prepared and understand the importance to come to the pharmacy and get vaccinated when the time is right. So thank you again. And yes, definitely let's educate as the time goes on.
Thank you so much. And Dr. Dominic, real quick, final thought?
Yeah, certainly. I just wanted to just say that we know and acknowledge that there are special challenges during a pandemic. In this case, for Latinos, we also recognize that we have COVID-19 mitigation efforts that can help us from getting COVID and from spreading it. And that it's very important to continue to follow these mitigation efforts at home, at work, at school, and in the community. And mitigation efforts, again, of washing your hands frequently, avoid touching your eyes, your nose, and your mouth, to make sure that there is social distancing, that you wear a mask, and if you're home, to stay sick if you're able. This is all necessary because we need to reduce the COVID-19 incidence, morbidity, and mortality rate. I just want to also end by saying that since the beginning of the pandemic, we've been very proactive, all of us, both everyone here on the panel, as well as your local communities, and even the efforts that you've made. We've been proactive, and we've been, from a Highmark perspective, we've been anticipating and planning for this day where we now have a vaccine that will soon hit the market. And we're going to continue to closely monitor this COVID-19 vaccine development and the distribution to make sure that it is evidence-based and timely and accurate and efficient, and have these policies ready for our members, including Latino members, and in the community. And so I thank you again for your time and allowing us to be part of this discussion. And I also want to just end to say we want to be part of the solution, and we remain fully committed. And anything that we have, especially these vehicles, we really strongly believe that they are transferable and that they could be used for equitable COVID-19 vaccine distribution. And we're committed to do that.
Thank you so much. I want to thank the panelists, Nanette Cosero, Rena Shaw, Dr. Aurelia Dominic, thank you so much, and Dr. Peter Hotez, who had to leave us early. But this is a really important discussion, and we could have gone for longer and longer. But I want to thank everybody who participated, the panelists and the audience. I want to thank the CHCI for having us on. And we will obviously continue this discussion as we get closer and closer to the vaccine being available. And I want to thank all the audience members for your excellent questions. And also want to let everybody know to please, if you can, continue tweeting about the Health Summit at CHCI Summit. And we encourage you to attend the afternoon breakout sessions. You don't want to miss the afternoon plenary session today at 3:30 Eastern on digital health, addressing the needs of underserved Latino communities. And if you know anyone who would still be interested in joining us for the closing plenary, it's not too late. You can register at chci.org. So thank you very much. Muchas gracias. Have a great afternoon. Bye-bye.